I'm going to hand over now to Sarah Delaney from NHS England, who's going to give us a bit of an update on GP Connect.
My name's Sarah Delaney. I work in the GP Connect team at NHS England, along with my colleagues who are also on the call, so Debbie Janes and Jane Nichols. I'm just going to give a very brief overview on the next slide as to what GP Connect products are and what GP Connect does and doesn't do. GP Connect is not a thing. It's not something that you log into. It's not something that you can physically see within your practice. It's just integrates with the different systems. So what we mean by that is it will send messages between the system suppliers. So it will send messages between EMIS and TPP and vice versa. And it will also send messages and appointment bookings from 111 suppliers that you may be familiar with. And also, if patients are seen outside of their practice, you can also receive documents from whichever care setting those patients have been seen within. So in the top left here, we've got the 4 products that we have at the moment, and this is just a very little roadmap just to show how some of these products could be used in a patient journey. So if a patient was to call 111, the 111 call handlers could view the patient record, and that would be done by one of our products, which is Access Record, be that in a HTML view or in a structured format. And what we mean by that is a HTML view is just an extract taken from the GP clinical system, and it will just show a brief snapshot at that point in time of patient information such as medications, etc. If the call handler has then proceeded to say, actually, the patient needs an appointment, so within your practice, you probably offer appointments to 111 to allow them to directly book. And again, this sits nicely with our product here, which is the appointment management. And you are in control of which appointments you make available to 111. They may have antibiotics prescribed, and again, that would be part of an access record view at a later date once those have been done. If a patient's been seen outside of their practice, then a PDF can be sent back to their registered practice, and that is one of the products over here, which is Send Document, and that will then sit in the patient record, waiting to be reviewed. And then, like I say, it will all then be available within the patient record the next time that a clinician would want to view that record. There's some information here about auto ingest, but I think that will fit quite nicely into probably what a lot of you may have questions around, which is GP Connect update record. So GP Connect update record is predominantly, and at the moment, is the only use case that we have, which is to do the Pharmacy First delivery. So for Pharmacy First program, what the Pharmacy First team are, that they will offer patients who go into a pharmacy, have a consultation, and they may present with one of these 7 conditions over here. And if they are presenting with one of these conditions, the pharmacy now have the ability to prescribe antibiotics to the patient, see them as part of the consultation, and the information is sent back to the GP record, which I'll come back to in a second. The Pharmacy First programme also delivers the blood pressure service and the contraception services as well. So at the moment, those are the 3 live clinical services that the Pharmacy First team programme are delivering. There's approximate numbers here, so 10,000 pharmacies, 6,500 GP practices, and how that's made up, it's the different suppliers of those systems. So the pharmacy systems, the GP systems, and then the systems that the pharmacy will use within their own systems. So whereas you would use EMIS or TPP, they will have their own systems that they will use within pharmacy. The blood pressure check service. So again, this is just where patients have a consultation as opposed to going into practice to have a blood pressure check. It can be carried out within the pharmacy, or contraception can be given as part of a pharmacy consultation as well. The reason behind the Pharmacy First team, so the drive for it is to kind of move patients away from going into primary care into GP practice to make an appointment if you have a sore throat, just to make sure that, you know, that it's releasing some of that capacity within GP practices and that pharmacies are able to administer these antibiotics. And I can speak from experience because my son had exactly this. Went to the pharmacy, was given antibiotics without the need for a GP appointment. Where we are at the moment, we're in first of type. So that what that means is that all of the pharmacy suppliers that we have that have been assured by us to make sure that the information that they send across to us is sent across in a structured format. So it's all sending the consistent messages. So if it's a blood pressure reading, it comes across in the format we would all know and understand. It's not free text. If medications are prescribed, that they are prescribed in a format again that you can see, take one tablet 3 times a day or whatever it may be, so that it comes in a way, it's not free text, it's not anybody's interpretation or minimum information. They have a minimum set of information that they will capture within the pharmacy systems, and that is sent then across into the GP systems. What we mean by that is it will come into workflow. So every patient that has a consultation within the pharmacy, if I say GP, I don't mean GP, if they're seen within the pharmacy, patients, so anything that there's a safeguarding concern, or if there's anything around the patient that they don't give consent for that information to be sent to their practice. So for example, a contraception service, they may or not want the GP to see that they've been prescribed antibiotics. So the patients and the pharmacy have those conversations around what information and whether they consent to it to go back in. And also that's for any patient-facing services. So what we mean by that is any patients who use the NHS app, they could then consent to whether they want that to be visible to the app or not. That's just a very small, awful screenshot of what it looks like in EMIS. And what it will do, so I've been seen in the pharmacy, I've had a blood pressure check, they've logged all of that information in their pharmacy system, I've consented to share with the GP practice, and a summary of that is sent across into workflow. So nothing other than medication is auto-filed within the record. And what we mean by that is it will sit within workflow in the same way that you receive any other external documents from any other organisation. So 111 reports that you currently receive, they will come into workflow for you to manage. Any medications that are prescribed, they are auto-filed. And why we do that is to make sure that if patients been seen in pharmacy 1, that they're given antibiotics, that they don't tootle down the road to pharmacy number 2 and request the same antibiotics. So it's visible to any clinician who wants to see, well, Sarah's just half an hour ago just been up the road and just got some medication. It's just to make that information visible to any clinician who would be viewing the record. The consultation summary won't contain anything that's urgent or any safeguarding. The pharmacies have their own SOP, so the standard operating procedure, where they will know how to manage these patients to make sure that anything that's clinically urgent isn't sent through to the GP practice, last thing on a Friday evening, and the practice don't open till Monday. They understand that, they will have to manage those patients. The summary will come into EMIS in workflow. It was like any other document will be there as a provisional document until it's been approved by a user. And that will be a local process as to who manages those and reviews those. It could be a clinician, it could be admin teams, it's whoever within the practice would be authorised to have a look at those. What information is sent? So the patient demographics, we do that via PDS. So because it's coming across GP Connect, which is in effect Spine, as soon as pharmacy say, okay, we're happy to submit this information for Sarah, we've captured all of her information, that message is popped up to Spine. Spine goes, yep, we know where we're sending this. We know where Sarah Delaney is registered to. We know her GP practice. And they pop that information then into whichever GP practice I'm registered with. And it will sit there. So that's the verification. So you're not going to receive inappropriate ones. It will show date and time of consultation. It will show the pharmacy details, so where that patient's been seen. It will show the outcome of the consultation and who has actually seen that patient, so who they are within the practice, what the patient's presented with. So it could be that I've gone with a sore throat. It will show the summary of that consultation, if there were any observations that were required, so BP for maybe contraception services, temperature if needed, the pregnancy status. So it's sort of the standard questions that the pharmacist will ask the patient when they go in. That's the information that comes through. And like I say, it just sits within the workflow for the practice. I know there's been some conversations over the last few weeks around turning this capability on or off. At the moment, you won't probably receive any of these because it's not been rolled out across the country. We don't have all of the pharmacy suppliers who are assured, and we're still waiting for some of those to go through compliance and assurance. So there are only 3 at the moment, I think, that we have. That could have changed this week. But we need to make sure that the information that they're sending is accurate, that it's coming into the GP systems in the right way, before any of this would be rolled out. Practices do have the ability to turn the functionality on or off. If you don't have the functionality enabled when it is rolled out, you will receive the information probably via NHS mail. That will be the default position. And then you would have to do a manual transcribe. Sorry, there's lots of background noise. Sorry. If you do receive it via NHS mail or via letter, it depends how the pharmacies decide to send that information to you. There will be the manual transcription from that email or letter into the GP record. There is a section within EMIS that's specifically for GP Connect products, and we've always had the ability to toggle those on or off as to whether you want to use them. For update record, I know there's probably some nervousness and questions around what information's coming in, what is it that they're asking us to do, and hopefully we've answered some of those questions. There's a lot of information that's been produced by the Pharmacy First team, because obviously this is the capability that they wanted to use update record for. So they've introduced an FAQ document, there's a dedicated web page, there's lots of Q&As on there. So if anyone does have any queries, we can pop the link to that in the chat. But anything outside of those questions, we're happy to take those at the end. And I've probably done a whistle stop, but I'm just trying to pull back a little bit of time for the meeting. Just one last thing to mention in case anybody isn't aware, we do have a user forum on the NHS Futures site. So Jane will probably know lots more about this than I do, but this is where we will just put information around any updates. We have a forum, so any GP Connect specific questions you can use, put onto there. We have lots of documents on there, so there's lots of information, and we can also put the link into, I think it's on that slide there anyway, but we can put a link into the chat as well for the user forum. I think that's it. Hopefully I've pulled back a little bit of time.
Thank you.
Thank you. There is just one question in the chat, so I will quickly just cover that if that's okay. So this was so this doesn't come into our EMIS system via GP Connect or workflow. So is there something we will need to do? So Debbie has kindly popped in a link with some guidance on that, and Sam has also come in. So we've asked NHS England to come in to just kind of talk through the functionality. It's obviously still very much a practice decision as to whether that's switched on or not, but obviously you've got the guidance there from Debbie if that is your choice to switch that on. So so that's all that's in the chat at the moment. Elaine.